Hypnotics and sedatives. Hypnotics and sedatives. Hypnotics. Hypnotics are drugs which produce drowsiness and facilitate the onset and maintenance of a state of sleep resembling natural sleep in its electroencephalogeny. Electroencephalogram EEG featured and from which the recipient may be easily aroused. The effect produced by hypnotics is known as hypnosis. Sedative. Sedative are the drugs which moderately depress the central nervous system CNS, moderate the excitement and calm the recipient. The effect produced by sedatives is known as sedation. All hypnotics in lower dosage act as sedatives. Both hypnotics and sedatives induced widespread depression of CNS. However, being mainly quantitative, all these agents are thus clinically employed as anti-anxiety, anti-epileptics, muscle relaxant, and or pre-anesthetic. For understanding the effect of hypnotics or sedatives, basic physiology of sleep mechanism need to be understood. Reticular activating system RAS is responsible for wakefulness, sleep, and wakefulness are depend on the release of neurohormonal substance drug that influence the activity of any one of the neurotransmitters would affect sleep processes. Seroto- Serotonergic neurons are richest in the Revi nuclei, which are located in the midline area of the pons and midbrain, and are closely associated with the ascending reticular formation. Many workers have reported that destruction of Revi nuclei cause insomnia in experimental animals similar to that as produced by the administration of p-chlorophenyllanine that prevent the synthesis of serotonin, reduction, depression, or inhibition of the activity of RAS result in sleep. Therefore, sleep can be encouraged by drugs that are known to inhibit transmission of impulses in reticular system. Based on the EEG characteristics, mainly two stages of sleep are important. Slow wave sleep SWS. During this stage, the eyeball remain motionless, muscles under chin are tense, and EEG show predominantly high voltage synchronous activity and subject is hard to arouse. Insomniacs generally have the normal SWS, rapid eye movement, REM sleep. In REM sleep, the eyeball make rapid, jerky and irregular movement, whereas the skeletal muscles completely relax. EEG show no spindles. These two stages of sleep alternate throughout the sleep period. The REM sleep maximally making up to 25% of the total sleep period. REM sleep is accompanied by dreams and 75% of the dream occur in REM sleep. Classification of hypnotic and sedative. Classification of hypnotics and sedatives. Depending on the chemical nature, the main group are barbiturates, benzodiazepine derivatives, and miscellaneous agent. Barbiturates. Barbiturates. These are the derivatives of barbituric acid, which is a condensation product of urea and malonic acid. Urea, malonic acid, malinuria, barbituric acid. Depending upon the duration of action, the barbiturates have been divided into four classes. Long acting barbiturates 8 hours or more. phenobarbital, barbitals, methylphenobarbitals, and apробarbitals. Intermediate acting barbiturates 4 to 8 hour. Intermediate acting barbiturates 4 to 8 hour. Example: butobarbitol, mefobarbitol, cyclobarbitol, and amylobarbitol. Short acting barbiturates less than 4 hours. Short acting barbiturates less than 4 hours. Example: pentobarbital, secobarbital, and quinolbarbital. Ultra short acting barbitals less than 30 minutes. Ultra short acting barbitals less than 30 minutes. Example: thiopentone, thiamylyl hexobarbitals, and methylhexitone. The long, medium, and short acting barbiturates are generally used as hypnotics and sedative. Barbitals, phenobarbitals, methylphenobarbitals, butobarbitol, amibarbitol, and pentobarbitals are the most commonly used barbiturates. Pharmacological action. Pharmacological action. All barbiturates have reversible depressant effect on the activity of all excitable cells. The central nervous system being more sensitive. Hypnotic doses, however, produce very little effect on cardiac, smooth, or skeletal muscle. Mechanism of action. Mechanism of action. Barbiturates primarily act as the GABA benzodiazepine receptor chloride channel complex and potentiate GABAergic inhibition by agglutinating the chloride conductance mediated by GABA. Preparation of dosage. Preparation of dosage. Barbitol sodium. Barbitol sodium. It is not given by intravenous route as it paralyzes the vital medullary centers. Administered by oral route, used as hypnotic, sedative, and anticonvulsant. Dogs 150 to 100 mg per day. Cat 100 to 300 mg per day. Amobarbitol sodium sedative and basal anesthetic dose in all species of animal is 4 to 11 mg per kg. Phenobarbital sodium dose 7.5 to 15 mg per kg TID. Cat 150 mg TID. Secobarbital sodium dogs and cat 30 to 200 mg. Pentobarbital sodium. Pentobarbital sodium for all species of animal. The oral selective dose is 4 mg per kg. However, IV dose is 1 to 1.5 mg per kg and is given to effect. However, it is generally used for anesthetic purposes. In swine, it is given intramuscularly 2.2 to 6.6 mg per kg body weight. Compared to short-acting barbiturates, long-acting barbiturates are better inducers of hematomicrosomal enzyme, and on molar basis, phenobarbital is the most potent enzyme inducer. It may take up to 7 months for its complete disappearance in dogs. Benzodiazepine derivatives. Benzodiazepine derivatives. Benzodiazepine derivatives. These are the most important sedative and hypnotic because of their high therapeutic index, least adverse effect on the cardiopulmonary function, and these do not alter disposition of other drugs by microsomal enzyme induction. These are used as hypnotics, sedative, tranquilizer, and anticonvulsant in animal. All compounds of this class hasten the onset of sleep, reduce the intermittent awakening, and increase the total sleep time. Benzodiazepine produce relaxation without affecting the voluntary activity. Depending on the duration of action, these are divided into two groups. First, long-acting benzodiazepine. Example: diazepam, clonazepam, nitrozepam, flunitrazepam, etc. Short-acting benzodiazepine. Example: midazolam, triazolam, trimazepam, lorazepam, oxazepam. Mechanism of action. Mechanism of action. Benzodiazepine act on midbrain ascending reticular formation and limbic system. These potentiate the GABA-ergic neurotransmission. Activation of type 2 BZP receptors result in interaction with GABA receptor chloride and NO4 complex and increase chloride conductance and hence decrease firings in the design of CNS. Preparation and dosage. Preparation and dosage. Diazepam is commonly used in veterinary medicine. It can be administered by oral, intramuscular, or intravenous route for sedation, anticonvulsant, and pre-anesthetic effect. Dose 1 mg per kg with a maximum of 20 mg by IV or oral route. Cat 1 mg per kg with a maximum of 5 mg by the same route. Got Gods 0.88 mg per kg by intramuscular route. Cattle 0.4 mg per kg by IV route. Swine 8.5 mg per kg IM route. In goat, diazepam has been reported to prolong the period of analgesia, increase muscle relaxation, and prevent reflex movement of limbs. Miscellaneous agent. Miscellaneous agent. Chlorhydrate. Chlorhydrate. Chloral hydrate is one of the oldest and most important and dependable drug for induction of sedation in large animals. For sedative use, it is administered by IV or oral route. However, IV route is preferred over oral route. Perivascular leakage should be avoided. In horses, it is used to quieten the animal for showing or other procedure lasting for 30 to 60 minutes and in treatment of colic. The typical sign of chlorhydrate induced sedation in horses are head drop, eye may close, incoordination of the hind limbs. Large doses may result in recovery take about 30 to 60 minutes. Dose: horse 22.5 to 30 gram, 454 kg per IV route. Cattle, sheep and pigs, camel. Paraldehyde. Paraldehyde. It is a rapidly acting hypnotics and is a polymer of acetaldehyde. It is devoid of analgesic action. Large doses produce cardiopulmonary depression. It is administered by rectal infusion and is used for the treatment of tetanus and strychnine poisoning. Methaqualone. Methaqualone. It has hypnotic, analgesic, anticonvulsant, antispasmodic, local anesthetic, and weak antihistaminic properties. Glutamide. Glutamide. Glutathione. It is pharmacological action are similar to that of the barbiturates. However, cardiopulmonary depression is no. Xylazine hydrochloride. Xylazine hydrochloride. It is a potent alpha-2 adrenergic receptor agonist and classified as an analgesic, sedative, and skeletal muscle relaxant. It is one of the most suitable sedatives for use in ruminant as these are most sensitive of all the domestic animals. The doses required for deep sedation and analgesic in cattle are 1 by 10th of that required for horses, dogs, and cats. However, it is not effective in swine. Intramuscular or IV injections of xylazine produce depressant effect on myocardial contractility, hypotension, and bradycardia. It also sensitizes myocardium to the action of catecholamine. Thus, the general anesthetics must be used very cautiously and the patient be continuously monitored following use of xylazine. Dosage: dog and cat, horse, cattle, goat, ditomidine hydrochloride. Ditomidine hydrochloride. It is a selective alpha 2 adrenoreceptor agonist and has been developed as a sedative analgesic for use in animals. It is not effective if administered orally and is thus given by IV or IM route. It causes marked bradycardia and initial rise in blood pressure, but subsequently the BP falls. Biphasic effect on BP. It is primarily used as a sedative analgesic in horses. It is effective at very low concentration dosage. Dose: cattle and horse, goat, sheep, medetomidine hydrochloride. Medetomidine hydrochloride. It is also a selective alpha 2 adrenoreceptor agonist and is a mixture of two optical isomers, the dextrorotatory isomer being the active component. It is used in animals as a sedative, hypnotics, analgesic, and premedicant. Cardiovascular effect like bradycardia, arterial hypertension followed by hypotension and reduced cardiac output are similar to that of ditomidine. It is non-irritant and can be administered by IV, IM or SC route. Like ditomidine, it is also effective at very low doses. Species: sedative dose, analgesic dose, dog, cat, sheep and goat. Phenothiazine derivatives. Pheno, phenothiazine derivatives. Drugs of this group are generally classified as neuroleptics or antipsychotics. These compounds have wide central and peripheral effect. The degree of sedation produced varies markedly between drugs. Sedation is an unwanted side effect in medical practices. However, in veterinary practice, phenothiazine derivatives are primarily used for these purposes. Details of the pharmacology of this group are discussed in chapter 10 under tranquilizer. Acipromazine. Acipromazine. It is probably the most extensively used phenothiazine in veterinary practice. Dose for most of the domestic animal is 0.025 to 1.1 mg per kg by IM route. Propionil promazine horse 0.15 0.25 mg per kg IM. Dog 0.2 0.3 mg per kg. Promazine horse 1 mg per kg. Trifluoropromazine camel 2 mg per kg IM. Thank you.